Almost 1 in 20 people in the United States will be affected by colorectal cancer in their lifetime. Up to about a third of those patients may be related to some type of familial or hereditary predisposition to develop colorectal cancer. What that means is because of some type of gene or something that's in their family, they're at increased risk. There's a smaller subset of patients, probably around 5% of patients, that have colorectal cancer related to a hereditary syndrome. So how does someone know if they're at increased risk for hereditary colorectal cancer syndrome? Well, if they develop their colorectal cancer at a young age, say at the age of 50 or below, that makes us more concerned for the potential for hereditary syndrome. Also, we worry about family members. So if a number of family members have been diagnosed with colorectal cancer or other cancers, such as ovarian cancer or uterine cancer, we're more concerned about the potential for hereditary syndrome. We're especially concerned if that's in a primary relative, say a parent or a sibling or a child who's had colorectal cancer. One well-known hereditary cancer syndrome is called familial adenomatous polyposis, or FAP. And what that is a syndrome that involves patients getting hundreds to thousands of polyps that coat their entire colon and put them at an increased risk for developing colorectal cancer. If one of your parents has this condition, you're at a 50% risk of having the condition yourself. But approximately 25% of the time, people who develop this syndrome are the first ones in their family to have it. They're also at increased risk of other types of cancers, so it's important to talk to your colorectal surgeon if there's a concern about having FAP. Another well-known hereditary colorectal cancer syndrome is called HNPC, and this stands for hereditary non-polyposis colorectal cancer. It's also sometimes called Lynch syndrome. This syndrome probably accounts for about 5 to 6% of all colorectal cancers that are diagnosed annually in the United States. How do we know that someone has this condition? It's usually related to the fact that the patient has a cancer at a young age, or they have multiple family members with colorectal cancer or other cancers such as uterine cancer or endometrial cancer. So it's important to talk to your colorectal surgeon about whether or not you're at risk for this syndrome. So how do we diagnose someone with a hereditary colorectal cancer syndrome? Most of the time it's related to high-risk features, such as clinical features, meaning a number of family members in the family have had colorectal cancer or other types of cancers. But ideally, patients undergo genetic counseling and genetic testing, and it's the gene testing that helps us to truly diagnose whether someone has a hereditary syndrome. Because of the increased risk of developing colorectal cancer, as well as other types of cancers related to these hereditary syndromes, it's important that patients and their family members talk to their physicians or their genetic counselors about getting appropriate screening and testing for these types of cancers. Most of the time, that screening includes more frequent colonoscopies. Colon and rectal surgeons are experts in the surgical and non-surgical treatment of diseases of the colon, rectum, and anus. They have completed advanced surgical training in the treatment of these diseases, as well as full general surgical training. Board-certified colon and rectal surgeons complete residencies in general surgery and colon and rectal surgery, and they pass intensive examinations conducted by the American Board of Surgery and the American Board of Colon and Rectal Surgery. They are well-versed in the treatment of both benign and malignant diseases of the colon, rectum, and anus, and are able to perform routine screening examinations and surgically treat conditions if indicated to do so.